I think it's important to understand where each of you are on your AI journey. Every organization starts from a different point in the process, be it starting to integrate AI as a first use case or fully scaling it across the enterprise. By understanding where you are today, we can better unpack your experiences and the pathways you've taken to reach this point, which will give the audience a clearer picture of what it takes to actually drive success with artificial intelligence. So, to ground us today in the discussion on your current AI adoption, Debbie, if I could start with you, could you give us an overview of where Temple University Health System is in terms of this AI integration? Which areas are seeing the most impact?
Certainly. So yeah, let's start by level setting. And I can tell you today we're having fun with AI like all other organizations are. We've developed some key strategic partnerships with large vendors that are specialized in key or certain areas. And we've also endeavored in some initiatives where we have failed. We've engaged in some that we've been slow to start, and we have a few that we've been incredibly successful with. A couple of the things that we're looking at is we evaluate each of the opportunities and determine if they have scale. Is the return or the value back to the organization and our patients on that investment? Obviously, the risk, hot topic of debate and conversation, the roles that are required within that technology, and also the changing regulatory landscape that we continue to see. And I think just last week, most of us can appreciate the fact that the federal government has been relatively quiet on AI, but we see states stepping up and filling that void, such as California and the requirement to disclose AI if it's being used in patient care. So a lot of us are doing that as best practice, but this is all greenfield that as we move forward, we're figuring out. So ambitions and hopes run high. AI is supposed to be that silver bullet that finally addresses the inefficiencies in healthcare. And we're starting to see some value from it. So I just want to note that we are generally a buy versus a build entity. And today on our leaderboard, which is probably what you really want to hear, the areas that are taking the lead are our radiology services. They began a strong journey in 2022 with diagnostic radiology and rapid identification of PE. They have moved a year later to start integration with our EMR so that we have one location for folks using our AI technology in radiology to be able not only to see the results of the AI, but also the clinical content such as labs and vitals. Next up would be our revenue cycle area, who's strongly taking the lead in coding and account prioritization. Our supply chain and our contracts folks, our legal folks, are using AI in contract analysis. We have a lot of very innovative work happening in our lung center. We're using AI to create documentation and summarize histories. We're dabbling in AI for clinical trial matching and research. And then, of course, service. Chatbots and service assistants are two elements of AI that we're engaging in or using today in our operations. So we're a little bit all over the board. I can tell you radiology, again, has had the greatest impact on two key areas, one being our emergency department and the other our outpatient services. They've helped with case prioritization and reducing the time to identify positive cases, and in addition to incidental findings. And I think that that's what we touched on in the opening today. It's all about insights, faster, and more efficiency.
I mean, Debbie, that's the list of projects. And you referenced California with that recent legislation. Josh, you're in California. UCSD has also been a leader in AI integration. Can you give us a sense of where you are in terms of scaling AI across your org, and what really your focus is right now in advancing its use?
Yeah, so we've been on this journey for quite some time. Obviously, it's been catalyzed by large language models recently, and it's been the focus, of basically any technology talk of late. We started, to Debbie's point, echo everything she mentioned. We started, I think, primarily in the radiology space. It was, a bit of low-hanging fruit in terms of opportunity, and certainly we had a captive audience in terms of, kind of helping to prioritize and understand how we can, treat patients faster. But we've scaled that, so we're looking at, I'd say we're a build and a buy and a partner approach. We kind of take all three, and depending on what the need is there. So give you some examples. We're on Epic for an EHR, and so we're certainly looking at a number of their models and have implemented in-basket auto response for patient messages. We were early on in that and kind of kicking the tires to understand the efficacy and the return. And I think that's a big part of this is in terms of scale is we've typically started small. We pilot to understand what the impact is going to be, and then look to see how much we can scale, how much we think scale is going to benefit us as an organization. In the case of in-basket auto response, we've now scaled that to all of our primary care providers and many of the specialists. And we're seeing some, I think, effective and positive results from that. And so that's kind of greenlit us to continue going. Similar in the radiology space, looking more on the build space. We built our own sepsis model that's using multimodal data from Philips monitors and Epic to then, an internal proprietary algorithm that's then helping to understand sepsis earlier. We've seen a 17% decrease in mortality for patients that have sepsis in the ED. And so that's something we decided to build, and that is now scaled across the institution. But again, it was started in a pilot to understand how it's going to work. In terms of partnership, we're looking at coding opportunities, right? So where can we automate coding, and where can we be more intelligent in that space? Computer vision is another space that we're in as well, and looking to partner on advancing that technology in terms of how can we predict patient falls or prevent patient falls, and how can we predict anomalies like fires, use it for RTLS and understanding where equipment is, so things like that. But we're kind of looking at it from all different aspects. In some cases, we're going to look to build. In some cases, we're going to look to buy. In some cases, we're going to look to partner with somebody who may have the foundation, and then we want to bring our expertise in terms of a user base. But in terms of where we're at, we've had a governance committee now for about 2 years. We've been iterating on that governance committee to understand who we need to have there. Most recently, it's been focused on having compliance and legal and ethics, to understand how these models and how AI is going to impact, our ability to, provide safe, high quality care, and making sure that's the cornerstone of what we do. And we want to be very conservative with our approach on that. And so that, I think our scaling has been a bit slower because of that. But as you mentioned, Dimitri, in California, we have a number of regulations and leading in the AI space. And so we're cognizant of that, and we agree that, we need to take this slow. I think the ramp up will be quick, but, that initial implementation and understanding of AI and where its place is going to be in clinical care is certainly important to really nail down.